Hi everybody, Dr. Stu Katzen here with Coach Eve for another episode of our video series. We did a video on the understanding the anatomy of the thoracic spine, the mid-back. Today I'm going to illustrate how we would more or less assess and treat that in a particular patient coming into the office with a complaint of mid-back air. So the thoracic spine, as we mentioned, the cervical spine is this part of the neck. We see there's 7 bones there. There are 12 thoracic mid-back vertebrae, and there's 5 lumbar low back. So in this particular case, I would do, orthopedic neurological assessment if there's any joint dysfunction, check for bilateral muscular asymmetries, and then check range of motion and flexibility. Once I come up with my findings, then traditionally I'll perform the first half would be the chiropractic treatment and how I would treat that. So that's the purpose of today's video, to show what it would look like if someone had dysfunction between their thoracic spine and how we would address this in a musculoskeletal perspective with manual therapy. So I'm going to have Coach Eve lay face down on the table. So I'll stand on this side of the table for the video purposes. So as we described in other videos, one of the things we do is I palpate the spine, check for any asymmetries, any muscle spasm, any muscle tension. I also check for joint play to make sure the spine is moving properly. If it's fixated and not moving properly, then by increasing mobility in the spinal joints, that will help the spine be more flexible, more mobile, more supple, and take pressure off those joints, off those nerves, and off the musculature. So quite often, when I first worked with a patient with a thoracic spine issue, and I also want everyone to understand these things are not also mutually exclusive of each other. So quite often I'll work on, for this video, work on the thoracic spine, but sometimes I'll work on all 3 regions, low back, mid back, and neck, depending on what's going on with that particular patient. So for purposes here, I'll use this instrument called a vibrocussor. What I do is I run this alongside the paraspinal musculature. There's muscles on either side of the spine to help relax those muscles, increase circulation, and also stimulate the nerves. Most patients say it feels really good as well, but ideally it's not, I don't want people to think of this as a massage. What this is really doing is a neurological stimulation to the spinal structures. Then often I'll also use an instrument called an arthrostim. This is a mechanical adjusted instrument. Patients usually enjoy this as well. It's a light tapping on the spine, and depending on which vertebra during the evaluation I found to be misaligned, what particular vertebra or multiple ones, we can actually use this instrument on the spine. It's quite gentle. Patients, as I mentioned earlier, traditionally like the way it feels. I also have an instrument called the activator, where I can also use on the spine individually on individual vertebra or ribs per se, if I need to adjust those as well, because that's something we'll look at during the evaluation too. Sometimes a rib can be out of alignment where it can be causing discomfort in people's backs as well. So, and then of course manually, quite often was the majority of the stuff I do would be more manual adjustments, where I will come in with my hands, take a deep breath in, all the way out, and lightly push on her spine. Sometimes you may feel a release, it sounds like a knuckle almost. And that's very gentle and feels a lot of relief. Patients will come in right after, sometimes after the first visit, and say, wow, that really feels much better, because things are fixated, not moving properly. So once we get the spine adjusted and people line properly, quite often we then give patients recommendations how they can self-care for themselves, whether it's mobility training, which will be on the next video, self-care, stretching, things they can apply themselves, ice versus heat, we'll be talking about that, and different things. But for this video, I want you to understand, even mix it up. So understand how a treatment would be. Timing varies because we're doing this for video purposes, but that would be more or less kind of an assessment we would do for the thoracic spine. Now, people always want to know how it feels. So how did it feel, Eve, that kind of adjustment?
Feels great. Yeah.
There you have it. Felt great. So with that in mind, if you guys have any questions, don't hesitate to ask any of the coaches at CrossFit. You can find out more information there. Oh, please feel free to call the office. Check me out while I'm there, or feel free to come to the office. Any questions, don't hesitate. Good luck. Hope you found this useful, and look forward to seeing you soon.